Good morning, everyone. As many of you know, February is Heart Month, and while many of us think heart disease is mainly a man's issue, fact is cardiovascular disease remains the #1 killer of both men and women. Joining us with how research and personal stories are driving change are Lacey Berlau with the American Heart Association, along with heart surgeon Dr. Damien LaPar. Good morning.
Good morning.
All right, let's start with the American Heart Association. You know, we've heard about it for decades now, and how it got started was a group of concerned doctors saying there's more that we can do to connect the dots here.
Yeah, so the Heart Association was formed over 100 years ago, and we shifted from that mentality of, oh, just go home and get rest to, let's fix this today. Let's, have a heart surgery. Let's take the right medicine. Let's take care of our bodies. And we are really focusing on shifting that message and making sure the Heart Association in the next 100 years is supporting that message.
Yeah, it boils down to what can we do on our own to improve our health. Also looking at technology and research, and just about every family, somebody who has benefited from this research. And I'll just, talk about me personally. My dad at 80 had a quadruple bypass, and back in the day at 80 years old, what would they have said to him?
They would have told him that he had a lot of risk associated with that, and that he would need an open heart surgery for that, and there weren't very many non-invasive or minimally invasive options at that time.
Yeah. So they cracked his chest because they looked at the rest of his health and they said, we think we can get you through this. The rest of your health is good. They cracked his chest and he lived 17 more years of quality life. Fast forward, my mom at 93 ended up having something called the TAVR procedure, which we were able to go through the groin and not crack the chest. And so that's just an example of how we can do better surgeries. And for that, the healing process is better, isn't it?
Yeah, absolutely. I mean, with these minimally invasive approaches, you mentioned TAVR, for example, which is exactly what you described. It's a technology where they're able to do valve replacements through minimally invasive techniques, going through the catheter, through the groin, or sometimes even through the arm. And it provides patients with a much better option. They're able to usually get their disease and their symptoms taken care of, but then they also are able to get out of the hospital sooner with usually a quicker recovery time.
And the doctor said that my mom talked to him during the entire time. He said, clearly she's the mother of a talk show host. All right, Dr. LaPar, you are an American Heart Association funded researcher, so you see firsthand how this money, what it does, what the money raised does, and what the information does.
Yeah, absolutely. Lacey and I were actually talking about this just a few minutes ago. In the world of academics and in the world of research and innovation and trying to find ways to move the needle in our space, it really is super important for us to be able to find ways to get extra funds to do research. And not only just research, but also education. And so, efforts like the American Heart Association, foundations and associations that are committed to that, and their mission is really to drive education and research in that way, it really helps out investigators so that we can find those new innovations, whether it's a minimally invasive technology like you mentioned, or whether it's finding a new medication that might be a game changer for patients, families, and their communities.
Yeah, and with that said, great care starts with us, and you give us that information to hold on to. I started by saying that a lot of times still this myth just permeates still, that we think that heart disease and heart attacks are really a man's issue. It oftentimes is a woman's issue as well. In the beginning, a lot of research was done only on men, so there wasn't a lot of information about how it presents itself in women.
Yeah, so that's 11 years ago, the American Heart Association started Go Red for Women, our movement to really encourage women to have those conversations, to talk with your mom, to talk with your sister, to talk with your aunts, to talk with your doctor about getting your heart checked, and not being ashamed of, oh, I'm a mom, I'm rushing around, I'm taking care of everyone else. Take care of yourself first.
Yeah, and of course, when they did that research mostly on men and said, here are the symptoms to look out for, what we found when we finally did research on women is that sometimes we present differently than men. So what are some of the symptoms that women in particular should look out for?
Yeah, I think in general, folks always are focused on heart attack symptoms or symptoms that they've heard about, crushing chest pain, shortness of breath. And those may be very real experiences for women as well, but oftentimes heart disease will manifest itself in women slightly differently. Sometimes it's unexplained fatigue. Sometimes it's not being able to keep up with the things that you would normally do, or maybe that you did 5 years ago are much more cumbersome and difficult now. And it's more subtle things like that that kind of present.
Yeah, and therein what lies the danger, subtle things, because we can excuse things away and think that's just the normal life of a daily life of any woman, right? Oh, extra fatigue, yeah, I know that, right? And the whole bit. So who should generally get checked?
Everyone. I mean, we say it at all ages, especially, you know, if it's in your family, if you have higher risk factors, if you aren't active, if you aren't eating the right things. Definitely that, cancer survivors, smokers. But I mean, like we still say at the end of the day, everyone, children should be getting that yearly checkup at their physicals. You know, women that have had that.
Yeah, and you say cancer survivors because if you've been through chemo radiation, that can have an impact on the heart as well. All right, National Wear Red Day. It's coming up on this Friday, yes. And go through what you hope people will do to embrace that.
Obviously, we would love the whole city of Houston to turn red, but then if you're at the grocery store and you see a woman in red, say, you know, go red, and have that message of, this is how I'm taking care of my heart today and every day.
Yeah, all right. And then Congenital Heart Defect Awareness Week starts Saturday, and that is very personal to you.
It is. It's actually very personal to both Dr. LaPar and
I.
I do have a daughter with congenital heart disease, and obviously she is a daughter and a woman and will grow up and will need to take care of her heart from that time being, but 1 in 100 babies are born with congenital heart disease.
Yeah.
So if you look at an elementary school of 500, 5 kiddos in that school could be running around with it. And we've talked a lot about how you are finding those symptoms, especially with football athletes and that sudden cardiac arrest moving forward of, you know, diagnosing that too.
Yeah, and we were talking earlier, of course, about the innovations today. One of the things that's so amazing, one of my friends dealt with this, and we were talking about in the green room, that you can now do surgery on a baby in utero.
Yes. Yeah, it's an exciting advancement that we've been able to bring to our field and armamentarium of what we're able to do. And there are a variety of different things that we can do to help be proactive in helping babies' hearts grow and their cardiovascular structures grow in a more normal way. And that's an exciting thing. Oftentimes what we deal with as surgeons, as a pediatric heart surgeon, is I'm reacting to a scenario, and we would like to really flip that script and be more proactive in trying to help prevent the development of structures that are going to go down a pathway of abnormal formation and get them back on track to develop more normally, so we can have a better impact on that child's care.
And then, of course, being more proactive in our daily lives to try to avoid heart disease than to begin with. And I know you have all these things listed on your site, but sometimes it becomes overwhelming if you think you have to just change your whole world.
Yeah.
You don't. The body is very forgiving, yeah. And it's also very reactive to small changes.
Yeah, I think when you think about heart health, which is what we're here advocating for and really talking about this entire month, and especially this coming Friday when we're all wearing red, would be thinking about ways that you can make incremental changes, small changes in your daily life that will add up over time to be very positive effects on your heart health. So examples of that would be planning out your meals or your lunches the next day so that you're not reacting to the fact that you don't have a plan for what you're going to eat, and maybe making a choice for the food that you're going to eat that maybe you wouldn't have been.
Yeah.
Trying to stop smoking. We all have New Year's resolutions. Everybody joins gyms, it seems like a lot. But if you try and do a comprehensive big change in your life, the ability for that for you to stick with that can be difficult. Yeah. So find small things you can do, and the biggest piece of advice that I would give people is make sure that you keep your doctor's appointments every year.
Because you got to monitor that. Things can change and take off on you quickly,
yes.
Right? If you get ahead of it, you can avoid those big issues. All right, the Heart Ball is one way that you all raise money.
Yes, so it is this Saturday. It is a don't miss experience. And what we're fortunate is, yes, it's a one night that we are partying and we're celebrating all the work we're in Houston, but it's a year-round effort. At the Heart Association, our 4 key pillars are hypertension, which is blood pressure, CPR training, hands-only CPR, women's well-being, and nutrition security. Yeah. So we are focusing on those 4 pillars throughout the Heart Ball and throughout all of our movements and campaigns to really make Houston a healthy community for all of us.
Yeah, and with the right information, like goodness knows we have the best technology in the world, but we don't have to get to that point. If we do our part, there are so many more people who will never have to deal with heart disease if we just do our part up front. Thank you very much.
Yeah, thank you, Deborah.
All right, National Wear Red Day. Again, that's this Friday. You can show your support by wearing red and starting the conversation about women's heart health. To learn more or get involved, visit goredforwomen.org. To learn more about the American Heart Association, visit heart.org/Texas.